hope everybody's doing well. All right, so I've been tasked with making a presentation. That presentation is essentially to try and address myths and misconceptions that pregnant women mostly have in terms of childbirthing. So we're going to try and address some of them, some that involve the early parts of pregnancy, some that involve the labor process more especially. So I'm going to run through a number of slides as quickly as possible, and then we will take questions, and then we also want to hear some people's experiences when it comes to some of what you have heard relating to pregnancy, so we can try and address that. So as I've mentioned, safe childbirthing, and we're looking at the myths and misconceptions about childbirthing. Now, we all know safe childbirth is a desired outcome of all pregnancies, and knowledge about the pregnancy process and the childbirthing process helps to dispel some of the challenges associated with it. Childbirth is surrounded by myths due to cultural beliefs, old wives' tales, and some misinformation, and these myths can cause unnecessary fear or unrealistic expectations. I just need to quickly touch on this. This is one of the themes that we have at Clearview, to say that safe childbirthing, and we need to understand what a safe pregnancy is and what safe childbirthing is all about. So a safe pregnancy is one that results in a healthy mother and baby or babies. We know that a lot of our patients will come with twin pregnancies, some triplets, some even quadruplets. So a safe pregnancy is one that results in a healthy mother who has attended antenatal clinic properly and healthy babies. Both mother and babies should be free from serious complications. And also the safe pregnancy is one that occurs from conception to term, which is 37 to 40 weeks. There is room for some preterm deliveries to occur, pregnancies that are occurring at less than 37 weeks. Some examples we have twins or triplets. Those babies are notorious for not waiting for the whole 40 weeks. Sometimes they will come a bit earlier, between 34, 35, 36 weeks, but it can still be termed as a safe pregnancy, especially if your obstetrician or your medical team has planned the delivery of such a pregnancy. And how do we achieve a safe pregnancy? It is achieved by optimal antenatal care. We make sure that as soon as you do get pregnant, you come for antenatal care. You also achieve what is called a safe delivery. It can be by any means, a vaginal delivery or a cesarean section. And also, we know that it's not just about having the baby or delivering the baby. It's also, the postpartum period, having a safe postpartum period where mother and baby are also in good health. And where does a safe pregnancy or safe delivery occur? The environment must be safe. It must not put the mother or baby at risk in terms of hygiene, risk of infection, risk of harm to either the mother or the baby. The environment must have skilled healthcare attendants. I like to call it a multidisciplinary team, which comprises midwives, pediatricians, obstetricians, and then it must be equipped with, basic or comprehensive obstetric signal functions. What these means is things like antibiotics. The woman has some, issues that arise. She's bleeding, the placenta is not coming out easily. You must have a team on ground that can manage that, you understand? In a lot of instances, we also like to believe that an environment must have a theater just in case labor is not progressing properly. An operating theater to be able to carry out a cesarean section, laboratory, blood bank, and if need, they must have the means to refer a patient if there's any imminent danger that cannot be managed in that facility. All of these, as we know, Clearview is well equipped with all of these to ensure a safe pregnancy and a safe delivery. Now, in terms of definitions, what are myths and what are misconceptions? Myths are generally a widely held but false belief or idea, and this may come up due to, cultural, traditional, experiences of people. Okay, a misconception is generally just a belief or idea that is not based on correct information and that is not understood by people. So, having said that, I will jump straight into some of the myths that over the years, experience obstetricians. These are some of the questions and myths that our pregnant women who are attending antenatal have asked. Myth number one is food and drugs ingested can result in fair-skinned and more beautiful babies. We've heard that a lot of times. Some patients will come and say, I need to take omega H3, make sure my baby's skin is fresh, my baby is beautiful, and all of that. Now, the facts that exist are this. Number one is that good nutrition generally results in healthier babies. It's not about the supplements you are taking. It's not about, any particular drug you are taking. Good nutrition generally, while the woman is pregnant, results in healthier babies. That's a fact. Specific food supplements and creams have no significant effect on the complexion of or skin of the babies. I would like to tell patients that genetics is what determines how your baby looks, how the skin of your baby is going to come out. If you are dark-skinned, your husband is dark-skinned, it's most likely that your baby is going to be dark-skinned. It's not about taking any particular cream or retinol or anything like that. Your baby is going to take after either you or your husband in terms of complexion and how beautiful the baby is. Another common thing we hear is cold water. Taking cold water in pregnancy causes the baby to have runny nose. There's no correlation whatsoever. By the time you drink cold water, it gets to your stomach. 2 or 3 minutes later, it's body temperature. And there's no connection between your stomach and the uterus that will cause the baby to eventually develop a runny nose. Myth number 2. Sex in pregnancy is not safe, especially for the baby. We tend to hear this a lot, saying that during sexual intercourse in pregnancy, the semen or sperm from the husband or partner can track up through the vagina and cause infections for the baby or affect the baby's mental development. This isn't true. As long as you're having safe sex. Safe sex means, sexual monogamy. Your partner does not have any sexually transmitted infections. Sex in pregnancy is essentially safe. We do know that, the hormonal changes that occur in pregnancy sometimes might just turn you off. Your mood may be low and all of that. Libido may essentially drop in some patients, or it's the reverse in other patients. Libido may actually go higher in some patients. So, and then the other thing about sex in pregnancy is that within reasonable limits, there are certain category of women who we will advise abstain for sex temporarily. Women who have had spotting or bleeding during the early antenatal period or any stage in their pregnancy. Women who have had cervical saccages because they are either carrying twins or triplets, or because there's evidence that the cervix has started to open up. So these category of women, we will advise them to temporarily abstain from sexual intercourse. Another thing that I've heard is that sex is good for the labor process. I think I would like to just say that, look, sex in pregnancy is just good to continue to ensure, your partner has his urges are able to be satisfied within the home. If the pregnant woman is not having intercourse with her husband, the guy goes out, picks side chick, picks an infection, bring it back home, then the woman is also at risk from that. So sex also does not have any direct effect on the labor process. Some women will come and mention that I've not been having sex, my labor is going to be difficult. I like to say, no, this is not true. If you look at, allow me to say this, if you look at the size of the baby that is coming out through the vagina, it is more than 4, 5, 6, 7 times bigger than the male organ. So in no way is sexual intercourse dilating the vagina or dilating the cervix in any way. So myth number 2, sex in pregnancy is not safe. This is a myth. The fact is, sex in pregnancy is safe within reasonable limits. Myth number 3 is that exercises induces labor at term. We see a lot of women towards the end of pregnancy, they start to climb steps, they start to do all sorts of exercises with the hope that it will induce labor. Do not get me wrong. Exercise in pregnancy is permissible. Exercise in pregnancy is safe. And in some instances, once labor has been established, it is actually very helpful, even in positioning the baby's head during the labor process. But it has not been scientifically proven that exercises, any particular type of exercise, can help to induce labor. If it does happen, yes, we're happy it has happened, and find your way to the hospital so we can take the delivery. So exercise may help with labor progression once it has started. It also strengthens pelvic floor muscles, and it may improve the baby's position, just like I have said. So exercise is safe in pregnancy, but that it induces labor is not a truth, as far as scientific evidence has shown. So myth number 4, the due date is exact. I've had patients who will come and say, they keep emphasizing, doctor, what's my EGD? What's my due date? What's my due date? Once you give them that date, in fact, you can't tell them any other thing. But what we do know is that the due date is actually a range or a marker for us to know that we do not want the pregnancy to go beyond a certain point, and we do not want the pregnancy to come far earlier than a certain point. So only about 5% of women will deliver on that their exact due date. Normal pregnancy can last between 37 to 42 weeks, just like I've said, and doctors will continue to monitor for safety, but your baby will come when it is ready. Myth number 5 is that labor always starts with breaking of water. You can see in the picture below there, it's always shown as the way it is shown in Nollywood and Hollywood. It's very dramatic. The woman is doing something, then you have this splash of water, and then she screams. Well, that is how it happens in the movies. But in real life, it's not that dramatic. You might just be sitting down, notice your underwear is wet, or there's fluid trickling down your thigh. That's how it does occur. And only a small percentage of labor cases will actually start like this. A lot of women, the waters will actually break when they are established in labor, or when the medical team comes and says, okay, look, we need to rupture the sac of the baby to allow the water to come. It's a means of monitoring the well-being of the baby as well. So what we do know about labor, you hear it a lot of times when you are doing your antenatal classes. There are majorly 3 signs. The contraction, which become regular, increasing intensity and frequency. Then there's passage of show, which may be just clear show, it may be bloody, mixed with some little blood, then the breakage of water. And there's no specific order in which this signs will occur. It's not that the water must break first, then you start to contract, then you see show. For some, it might just be the contractions. You get into the hospital, you find out that you are more than halfway or even almost done with labor. So there's no specific order to the signs of labor, as in which one comes first or which one comes last. And the fact that labor will not always start with breaking of waters. Myth number 6 is that induction of labor always, small error there. Induction of labor always ends in a cesarean section. Now, some percentage of our women will require that induction or their labors will be induced. What that means is we try and help you fall into labor probably earlier than is required, or you have gone past your due date, or there's a medical reason. Maybe the woman is having elevated blood pressure, She's developing preeclampsia, and we need to control the blood pressure. And the best way to do that is to deliver the baby, or that the baby is not growing adequately. And once babies are not growing adequately, there's a risk of them dying inside. So we need to find a way to get the baby out. Induction of labor sometimes is, a necessary step to try and ensure safe delivery of the baby and the mother. I put there in the first bullet points that pineapples do not induce labor. A lot of our patients will come when they are 37, 38 weeks. We know that the weight of the baby, the mothers are tired. We would not then say that pineapple, if I take pineapple, will I fall into labor? No. A lot of times you will find out this is not true. There's also the question that is it safe to take pineapples earlier in pregnancy? What I would tell my patients is, yes, you can take pineapples. Pineapples does not contain anything that will lead to a miscarriage or an abortion, but emphasis would be on moderation in your ingestion of these pineapples. Don't take the one that is underripe. Don't take the one that is overripe. The one that is just right. A slice or two will not do you any damage at all. So back to the point about the induction of labor always ending in a CS. Not all induction of labor will end to a CS, but the point to note is that once you start an induction of labor, it must end in a delivery, one way or the other. You can't start an induction of labor and say, let's stop at this point, come back in 3 or 4 days. Once you are committed to an induction of labor, it must end one way or the other. And then most times, when your doctor is telling you, let's induce labor, the aim of that is to try and achieve a vaginal delivery. It is if things don't go as planned, then we may have to revert to a cesarean section. What are the things that can occur that will make us revert to a cesarean section? Labor is not progressing. The head of the baby is not descending any further. After 2 or 3 successive vaginal examinations, you find out that the woman is stuck at 5 centimeters. 3 hours later, you come back, or 4 hours later, she's still at that 5 centimeters. At that point, labor is not progressing, either because the baby's head is too big for the pelvis, or the cervix itself has a little bit of an issue and is not going to dilate any further. And then it's also important that the appropriate method of the induction of labor is done. Some people think it is just about setting up oxytocin infusion. There are steps to the induction process. And so most times you come into the hospital, it might take 2 days or thereabout for us to prepare you for, the induction of labor itself. Your cervix has to be right for the induction to succeed. Then there's also the question about the pain of induction of labor. That's what I put as IOL, that the pain of induction of labor is more. What I tell my patients is all labor, whether it's induced or natural, all labor is painful. But that the difference with induction of labor is that the pain comes a lot faster. Natural labor, it starts off very gradually. You eventually get to the peak of the pain with natural labor. Let's say, for instance, it would take you 6 hours to get there. But the pain of the induction of labor, it will probably reach its peak at 2 hours. So the pain also depends on, the pain threshold of the patient. So whether it is more painful or not is dependent on the perception of the person who is going through. But there are always options for pain management during an induction of labor. Okay. Myth number 7 is that childbirth ruins your body. This era where everybody wants to have a snatched body, that's the term I learned recently. I want to snatch back immediately after a childbirth. The truth is that the human body, the way God has designed it, is designed to recover after childbirth. It may not get back to 100% of what you had before, but it will get back to what is pretty much close to what you had before. All the weight that you have gained earlier in pregnancy, you will most likely lose it. Okay. You hear some women who say, after childbirth, I started to get bigger and all that. Yes, there are individual variations when it comes to it, and I also like to tell patients that personal effort to lose that weight is what is important. Um, by the time you start to breastfeed, you are taking care of the home. Who has time to start doing exercises? So a lot of women will probably, because of the sedentary lifestyle they are having postpartum, they may gain some weight, or the weight does not go as fast as they want. But as I mentioned, personal efforts. Then you also can't diet too much because you are breastfeeding. So during the immediate period shortly after the delivery of the baby, yes, you don't expect a snatch back body because breastfeeding in itself, you would require good nutrition and all of that. But it's also doable that if you're able to resume physical exercise after your postnatal period, then yes, you should be able to get your body back. I had a diagram here, something about stretch marks. You see the one on the left has a woman who has stretch marks, the one on the right, the lady who has had a cesarean section there. Stretch marks, unfortunately, may not be reversible back to the way it was, but I would tell patients, look, it's a badge of honor just to show that this is the process you had to go through to birth this wonderful human being that you are preparing so eagerly to have. And then there's a common misconception also, the last point I put there, that cesarean section versus vaginal delivery, the tummy fat. Well, the point is, some women will say that a cesarean section won't allow the tummy fat to go, that the vaginal delivery allows it to go. It's not true at all. You find out that as women grow older, even men as we grow older, there's what's called central obesity. We start to have fat, around our tummy area. So there's no difference actually between women who have a cesarean section and a vaginal delivery in terms of tummy fat. If you are destined to have tummy fat, you will have it, whether it is cesarean section or vaginal delivery. But as I've mentioned, exercise, dieting, doing some tummy exercises, sit-ups, or eating healthy will help you to lose the excess fat gain during pregnancy, and will be able to help you to achieve a toned body. Myth number 8, a cesarean section is the easy way out. The fact is that the cesarean sections are major surgeries with some significant, complications on occasion, and it can also lead to longer recoveries. That it's the easy way out is not always true. It may be the safest way out, but that is the easiest way out. It should not be true. Cesarean sections should usually be for medically indicated reasons. A lot of times we have, especially here, we have a lot of cesarean sections for women who are carrying multiple pregnancies, medical conditions, elevated blood pressure, or women who have had previous cesarean sections, have had 2 or 3 previous cesarean sections. Those kind of category of women, we do not want to take any risk with them, having a vaginal birth that can lead to a rupture or something undesired. Okay, the fact is also that cesarean sections can be more challenging than vaginal birth in terms of recovery. But as long as this is medically indicated, you are having it done with the very best of hands who are really experienced in it. They know what they're doing. They'll be able to help you through the recovery process. Cesarean sections are actually safe in this day and age. However, not the easiest way out. I've had some patients who will come after the first vaginal examination or first hour of contraction. They say, nope, I'm not doing this shit anymore. I can't bear this pain. But you do have to know that even the pain of the cesarean section is also there. Vaginal deliveries are the most preferred routes, but not everybody will have vaginal delivery. Cesarean section may be the safest, option for both mother and child. The 9th myth is that all mothers are blissful and happy after childbirth. That once the baby comes out, it's blissful. Everybody is happy. You can see the picture of the woman down there. This baby is probably about 5 to 6 months. But the truth is that behind this smile that the woman is having and the smile of the baby is a lot of hard work, a lot of sleepless nights, a lot of waking up every 2 to 3 hours to breastfeed the baby, pain while she's breastfeeding the baby, and all of that, and frustration because the baby's just crying. You can't figure out what it is. So the bliss, maternal bliss that you will eventually, come to enjoy is just knowing that you have birthed this really wonderful, really beautiful baby that you desired. Okay, but it does not go without its own challenges. It does not come naturally, and it comes over time. There's something called the baby blues. This can occur 2 to 3 days after birth, and it's mostly due to the withdrawal of the pregnancy hormones. While you are pregnant, the hormones are almost like steroids. You can imagine somebody who's taking steroids and then all of a sudden you withdraw the steroids. You can become moody, a bit withdrawn. The pressure of taking care of the baby is there, and then the woman may just experience what is called the baby blues. If it isn't well taken care of, it can actually progress into depression. Okay, with the woman is just she may just feel that nobody's paying attention to me. This stress is too much. I'm not well prepared for this, and then it leads to depression with its own complications. But usually, we in this part of the world, we are very lucky. We have social support, or most people have social support. Your partner is there once you deliver. What the Igbos call mugo. You have somebody who's going to come help you with the baby, at least for the initial part. And this goes a long way to relieve the woman of the stress, especially since she has gone through the delivery process. You may have a cesarean section, it's still sore and all of that. And rest and support are very important. That's why a lot of times during the antenatal period, we would always ask, where's your partner? Who's going to be in the labor ward with you? Let them come into the hospital. Let's have those discussions and make them aware that, look, the woman is going to need a lot of support, once she has delivered her baby. And finally, the last myth I would be taking today is that you cannot get pregnant while you are breastfeeding. The benefits of exclusive breastfeeding are there. This is not refutable. Okay, it's very important that we know that exclusive breastfeeding is very beneficial to both the mother and the child. For the mother, it helps you actually to get back your snatch body, as it were. It helps the uterus to involute, go back to its normal size. And then, for the baby, the nutritional benefits is there. Antibodies, are rich inside breast milk, and then the nutrients as well. And it also promotes maternal and child bonding. Now, what we call lactational amenorrhea. Amenorrhea is not seeing a period. Lactation, of course. So not seeing a period because you are lactating, you are breastfeeding. A lot of women who will breastfeed exclusively will not see a period for a while. Most of us believe that if you are able to exclusively breastfeed it for 6 months, within the first 6 months, you most likely shouldn't see a period. But the reality is that, once you are done with your maternity leave, you get back, you may not be able to achieve this. For some people, maternity leave is 2 months, 3 months, 4 months. So, and you may not be able to do the exclusive. So in between that period, the woman may actually ovulate. And the issue is you may actually see a period. And we know that before you see a period, you have ovulated. So some people will not actually know that they've ovulated and they've gotten pregnant until like 2-3 months later, or they start to feel funny and all of that. So it is really important that the caveat for me is that exclusive breastfeeding will give you some protection, but it is not foolproof. So at the end of your postnatal period, once you have delivered 6 weeks, it's always advisable, please. We talk about family planning. We offer you the options, whichever option it is that works best for you. We'll be able to offer you that. You choose one. And the other thing I tell patients is if you choose one, it's not working for you, you don't like the side effects of it, you can always change it to something. And it's also very important to have your partners, involved in this process so that you don't just get pregnant back to back and then you come back and you're saying that I'm not planning for another pregnancy, and it can be quite distressing. So please, really important, by 6 weeks during the postnatal consultation, we will be talking about contraception and family planning. Family planning is deciding when your next baby is going to come. Then the contraceptive part of it is how to prevent getting pregnant before your desired interval. And then we'll also be talking about pap smear. If you had not been doing a pap smear before, we're talking about you getting a pap smear, and then possibly HPV vaccination will be done at about the same time when you are getting your pap smear. So that you cannot get pregnant while breastfeeding, it's a bit of a myth, but there are conditions for you to be able to achieve this lactational amenorrhea we're talking about. Okay, so as we promised, we're going to try and make it a bit interactive so that we also get feedback. Let's try and understand what it is that our women, our mothers or pregnant women are going through. So in conclusion, I'll just say that every birth is unique. Don't compare yours to others. Trust your medical professionals. Some of us have been in this game for a while. We do have a relatively, don't let me say fairly good, a really good idea of how to take care of you. And here at Clearview, we assure you of that. And then please always stay informed and focus on a safe, healthy delivery. If you have questions during the course of your antenatal period, please always bring it up with your doctor who is attending to you, or the nurses or the midwives, anybody. Please always write them down and discuss it with us. We'll be more than happy to address those concerns. So the interactive session, we will be taking questions, we'll try and answer them. We'll also honor contributions, anything that I have not mentioned or you feel it's very pertinent for us to address those points. I'll be very happy to do that for us. Okay, so throwing the floor open. If we have any questions, let's start to ask them. You can raise your hand, we'll acknowledge you and answer your questions. So do we have any questions? Okay, so first question I am seeing is folic acid safe all through pregnancy? Hold on 1 second. For just the first few months to prevent neural tube defect. The folic acid is safe through the whole of pregnancy. I've been seeing quite a number of those. Let me stop this. All right, so I've been seeing quite a number of things online where they're saying that folic acid should be taken only within the first trimester and all that. Folic acid is really important within the first trimester, the first 13 weeks, to prevent neural tube defects. That is the benefits for the developing baby. But the benefit to the mother is that folic acid is required to build red blood cells. It's one of the building blocks of red blood cells. So you notice a lot of times when you do come to clinic, we would always run 1 or 2 tests, blood tests, maybe every 3 months or thereabout, to check your blood levels. So make sure you're producing enough red cells. So a combination of your iron tablets, folic acid, vitamin C, all of that goes to producing red blood cells. And it's really important because the end point of the pregnancy, at the end point, either vaginal or cesarean section, you will lose some blood. The blood loss may be in the range of between 350 to 500 mils, or even in some instances, it might be more. So the more blood you have before the labor or the delivery process the better, so that even when you do lose some blood, you still have enough, and we're not bothering to say we want to transfuse you after delivery. Okay. Okay. So do we have any more questions? Yeah, you're welcome, man. Any other questions? Do you have any questions? I'll wait a little bit. Okay, so we have somebody who's having her hand raised. So maybe we'll just unmute her so that she can ask her question. Daria, are you there? Please unmute her.
It's all right, you can unmute yourself now.
Yes, good morning, sir.
Good morning, ma.
Okay, so I want to ask, what is like the percent of the normal blood rate that a woman needs before delivery that we know okay, this range is safe and you won't be needing transfusion after delivery? Like what's the range?
Okay. Okay, thank you so much for that. So generally, when we look at the packed cell volume, which is one of the parameters we look at when we're checking your blood levels, generally in pregnant women, the values are a bit lower compared to non-pregnant women. So the values we'll be looking at for a pregnant woman is lower. If so, let me just say anything between 25 and 30% is fair. Okay, 25 to 29. We'll just keep encouraging you. Please continue to take your multivitamins, folic acid, ferrous. We would like a PCV of 30 and above. So if you are 30 and above, beautiful. If you are in the range of 27, 28, 29, equally fair. We can cope with that. But the point is that at the delivery, we try to minimize your blood loss. And after you have delivered, we will check your blood levels. Your blood levels are now below 25%, 23, 22, 21. That is the point at which we'll be considering a blood transfusion. Okay. So at the point of discharge, if your packed cell volume is above 25%, you are good to go. If you are going into labor or delivery, 30 would be a good point. 30% would be a good point to enter labor or a cesarean section with. Okay, I hope that's okay for you. Okay. So somebody is asking, once there is a small opening after a CS on the stage, can penicillin be used to treat it after cleaning? Also, will there be another session on family planning? Okay. So after the cesarean section is an incision made on the anterior abdominal wall to deliver the baby. So we cut through the skin, the fatty layer, through the muscle to the uterus. We deliver the baby through the wound, and then we close up all those layers. Now, the closure of the skin, sometimes it's not always perfect. Just as you said, can there be a small opening? While it is that we try to achieve a perfect acquisition, that the skin is like that. In some instances, some people's skin does something like that. Okay? So there might be some little space there. The human body, as God has designed it, is beautiful. Once those kind of holes or spaces, the body will eventually heal. It will close over on its own, as long as there's no pus or discharge coming out of it. So part of the care you can give this kind of wounds is what we usually advise at the point of discharge is very simple. Cotton wool and methylated spirits should suffice. Okay. Then you maintain your personal hygiene. You're bathing 2-3 times a day. You clean the wound as often as possible, 3, 4, 5 times a day. Yes, penicillin can be applied. It's an antibiotic. It can take care of, if there is any infection. But for as long as you're able to keep the wound clean, it's very unlikely you will come down with a skin infection. Okay, but if you do have the penicillin, added benefit of having a local um, antibiotic applied to it. So it's not the penicillin that will make the wound heal. You must note that improved nutrition, the blood level, as somebody had asked earlier, if you have good PCV after cesarean section, your body will heal. That's the way God has designed this human body. Will there be another session on family planning? Thank you so much for that. That's very important feedback. Yes, we will also be talking about family planning in one of the next sessions that we will be having. Okay, so thank you for that feedback. All right, do we have any other questions? So maybe what we can ask is if anybody has any myth they have heard that you need clarification on. I've heard something like taking Lipton helps to reduce weight so that you don't have big babies, things like that. Is it true? Somebody has said using certain medication ensures that your body gets back to six pack and all of that. So let's know if you still have any myths like that, so we can add to our own list and try and address it. All right. So having hot water massage during the postpartum period, which has been discouraged, but it's still being practiced. I think the most important thing there is the massage, right? It's not really about the hot water. Anything that gives a woman who has just delivered some relief. She has gone through a major process. You have some women that are, they still have body pains. They are sore from lying down flat. Take, for instance, the woman who has been lying down on her back following a cesarean section. You might start to have pains all over the body. So yes, the massages are good. Okay, they are permissible as long as it's relieving it. But it's the hot water part of it that we do need to be careful about. Experience I had, my wife after her childbirth came and were put in hot water. She jumped out of the room, said the water was too hot. So even if you are going to do the hot water massage, it should be warm water or just something that is not going to peel your skin and give you burns. Okay. And it's not always mandatory. If the woman wants it, she experiences a little bit of it, she can always have it. Not that you tie her down and make her have hot water poured on her body or massage. And then the massage should be gentle, not deep massage that can break bones or damage muscles. So massages are good. If it's hot water, if it's cold compress, whatever it is, they are good. Okay. But the way that it had traditionally been done is actually dangerous and can injure the woman. Breastfed babies are smarter than formula-fed babies or babies that do both. Very interesting. Well, it's but please remember that. So this is my own personal take on it. Is this breastfeeding cannot be? You can't compare breastfeeding to infant, using formula. If breastfeeding has its own benefits, immense benefits, and especially in this our T-pain economy, it's more economical. But in terms of having them being smarter or not, remember that how smart a child is dependent maybe on genetics, also on the upbringing of the child. Okay. This is my own take on. If you have a child that is watching YouTube cartoon from morning till night, a child may not be smart at all. But educational programs, mental tasks, you're giving them activity books and all of that. Yes, eventually, you would be able to demonstrate or improve the innate smartness of the child. Personal experience, for medical reasons, my daughters could not breastfeed for more than a week. They are both doing really well, top of their class and all of that. So, it's and that was because most of the time they stayed with my grandparents who are educationists. Grandma was a principal, so she really paid attention to them, and I'm able to see the benefits. So it's not purely based on breastfeeding or formula feeding. There are other factors that would result in your baby being smarter. Okay. The myth about epidural during CS, does it cause long-lasting back pain? Yes. The epidural or spinal injection. So what we do most times in cesarean sections are spinal. There are two types of the injection. There's one, the epidural. The epidural is a catheter. There's a small tube that is passed into the back, and then the injections are, and it is left there, and the injections are, administered through that. The other one is called a subarachnoid block. That's the one we call spinal. The very tiny needle, it goes into the back to inject, and we take it out almost immediately. A lot of women will complain about the pain following this. I think from experience, it has to do with, you have some women who are having pre-existing, challenges with their back, orthopedic related challenges. The one that I think is related to this is those who have difficult spinal injections. So you have a patient who is either the shape of the backbones is odd, and the anesthetist has to prick a number of times. All that pricking, injection back and forth before they're able to get it can actually damage some of the tissue around the vertebra. So it's possible that the patient will feel some of that later, but that's in a very minor percentage of patients. So what we usually say at the point at which you're going to get those injections is just listen to the instructions, stay still. The anesthetist will tell you to bend your back really well so that he can get the space that the injection will go in, so that it doesn't damage any tissues there. Okay. Is pepper soup okay during pregnancy? Yes, I like to tell patients whatever it is you can tolerate during pregnancy is safe, as long as it's not alcohol, it's not cigarettes, it's not Indian hemp, cocaine, heroin. Any food that your body can tolerate, you are allowed to take. However, you do need to note that very spicy foods can cause some, like, ulcer type pains, if you're not careful, can lead to reflux and all of that. So while you are taking your pepper soup, you might just be careful not to over spice it. Pregnant women will say it's the spice that they actually want, because pregnancy will, blur the taste buds. So they really want the very spicy food. So please be careful. You can take your pepper soup, fish, turkey, cow leg, whatever, but please be careful with the extra spicing of it. Pepper soup is okay in pregnancy. Okay. Then we shouldn't be cleaning our breasts each time we want to breastfeed. I think we should clean our breast each time. Okay. The care of the breast should actually start before the baby is born. A week or 2 weeks before that, it's always good while you're taking your bath, make sure the areola and the nipple is clean. You can use your hand or a sponge, make sure it's clean. So I've seen patients who is at the point of trying to breastfeed, when the nurses will come to clean it, and you are seeing very dark, on the cotton wool that you're using to clean it. It means they had not been cleaning the areola before that. And then there's also the issue of if your nipple is retracted or is flat before childbirth, it's always important to have a look at that. You can always ask your nurses what to do if you have a flat nipple. But yes, I think it should actually start before breastfeeding proper. The hygiene of the breast, start to clean it. And of course, each time you want to breastfeed, it doesn't have to be with soap, methylated spirits, or anything. Even just water will suffice to clean the nipple. Okay, and just yeah. So I don't think it's necessary. Okay, it might be necessary, yeah, to clean the breast before you breastfeed each time. Yeah. For someone who experienced placenta previa during her first pregnancy, how long should she wait before getting pregnant again? So, placenta previa in first pregnancy, from what you're saying, most likely that patient would have had a cesarean section to deliver. Placenta previa is essentially just that the placenta of the baby is overlying the cervix. Okay. And it makes delivery of the baby almost impossible without bleeding. So it might be safer for such a person to have a cesarean section. So if the person had a cesarean section, the general advice into pregnancy interval is a year and 6 months. That's about 18 months. To ensure that, the wound had healed really well before she takes in again. So a year and 18 months is the ideal if it's a cesarean section. But of course, if it does happen that the woman does get pregnant before that, it's all well and good. Let her just present to the hospital early enough, and then she starts to get specialist care to make sure that everything is all good. Last question here: does Lipton reduce baby weight? I don't think so. I really don't think so. Okay. Even outside pregnancy, we take Lipton, we're not losing weight. So not to talk of if it's occurring in pregnancy. Okay. 44 mm by 35 mm anterior myoma. No. So that's about 4 by 3 centimeters. 4 by 3 centimeters is probably maybe just that big. If it's a single fibroid, I don't think it's going to be a major challenge. If it's anterior, if it's fundal, I don't think it's going to be a major issue. Such a woman may still be able to have a vaginal delivery if that's what your concern is. I don't think it would impact significantly on the delivery. But if you now have multiple all over the uterus, then yes, maybe it might. What will be the average weight of 2.6 kg baby at 32 weeks? Okay. Well, that's the average. Let me just do a blanket statement. So at about 36 weeks, we would expect the weight of the baby minimum to be about 2.5 kg. So if you're saying 2.6, okay, that might be a bit on the upper limit for 32 weeks. Okay, but if I'm seeing 2.6, I'll be looking at the likelihood that baby is closer to 34, 35, 36 weeks. Yeah. So, but generally, once your baby is if your baby is considered bigger than it should be, then we start to consider the possibility that maybe the mother is having some form of it could be genetic. It could be that your husband is a really big odogu size-wise, or some little glucose intolerance here or there. But I don't think this is too bad for 32 weeks. Okay, I think it's still within reasonable limits as long as you make sure you are not having any glucose intolerance in pregnancy. Okay, so we had set a 1 hour mark for this antenatal session. I'm really happy that we got some feedback. For me, the most important feedback is the issue of the family planning. So maybe at the next session that we would have, we would discuss family planning. So let me throw this out there. Family planning, is there any other thing you would really like to hear so that we're not just presenting something that's not applicable to you? Maybe you can just put in a few topics you would like to hear over the next few weeks. We can work on that. At least for those of us who have attended this, we can start to attend to your needs as required. Okay, so if there are no further questions, thank you everybody for attending this virtual antenatal class. We're more than honored to have you on this call and to have taken the last 1 hour of your time. Okay. Thank you, Madam Lawson. Thank you. Thank you so much. Thank you, Abimbola. Thank you so much. Yeah. All right, guys. So thank you, Chiamaka. So you guys have a lovely weekend. For those who will be seeing, I look forward to seeing you today and over the next few days. Yeah. Okay, thank you for that, Yewande. Infertility, postpartum care. Infertility, we can take that as a gynecological presentation, but duly noted. Duly noted. Thank you so much. Yeah. Okay, so 1 minute to our hard stop for 11. I think we're done here today. Thank you so much, everybody. Have a wonderful weekend. Dari, any additional information for us?
Nothing much. We just encourage every one of us to join to follow us on our social media platform at Clearview Hospital on all Instagram, Facebook, Twitter, LinkedIn, TikTok to get latest updates about our product and services. And we are moving closer to announcing we are moving closer to the launching of the Clearview Moms Club. We encourage every mom, every woman, every that identified at Clearview Hospital. Anytime they visit the hospital, they should ask the front desk for the sign up link so that they can sign up and so that we can launch it together. It's for them, it's for our babies, it's for everyone. And God bless us all. We'll enjoy the weekend.
All right. Thank you so much. Have a wonderful weekend.
All right.